Next is a very fun and futuristic topic, hyperbaric oxygen therapy. I don't know what this is doing in an emergency medicine book. Anyways, I've seen Brian Johnson also recommending this. He has said that no other therapy worked like this for him. So let's read. Especially for Delhi people, this is going to be heaven for all India. What are the benefit effects of hyperbaric oxygen therapy? Provides hyperoxygenation, thus reverses tissue ischemia. Limits toxin production, bacteriostatic and bactericidal. Reduces edema, stimulate angiogenesis, promote osteogenesis, wound healing, decrease inflammatory response, augments fibroblast replication, increasing collagen, blunts ischemia reperfusion injury, increases RBC flexibility, enhances leukocyte bactericidal activity, enhances antibiotic transport, and terminates lipid peroxidation. So oxygen is a double-edged sword. You know, the same oxygen can burn you and the same oxygen can feed you, right? It is also used in air and gas embolism in the deep sea divers. Because if we keep them in a hyperbaric chamber, it is going to stimulate the hyperbaric environment inside the sea, and the air embolism chances will reduce while the person slowly recovers inside the chamber. What are the indications for HBOT? Arterial acute ischemic events like arterial gas embolism, decompression sickness, central retinal artery occlusion, sensory neural hearing loss. So it is used in acute ischemic events, traumatic injuries, gas toxicities, infections, and radiation injuries. In the traumatic, if there is crush injuries and compromised flap, gas toxicity like carbon monoxide and cyanide poisoning, infections like clostridial myonecrosis, necrotizing soft tissue infection and intracranial abscess, and in radiation injuries like radionecrosis and soft tissue radionecrosis. It is also used in iatrogenic air or gas embolism during mechanical ventilation, bronchoscopy, endoscopy, central line, lumbar puncture, arterial line insertion, hip replacement, arthroscopy, spine surgeries, etc. It is used in acute coronary syndrome, stroke, or paralysis. When you suspect an air embolism, administer supplemental oxygen to support arterial oxygenation and increase the bubble resorption. Place the patient in a supine position. So, there is no proven benefit that a head down position increases the risk of there is no benefit of a head down position to prevent the air going to the brain. So just keep the patient supine. Cerebral air embolization or a left lateral decubitus. So just lie supine with turn to the left side. It traps the gas within the apex of the right ventricle and minimizes migration. Catheter aspiration of the trapped air may be attempted in those rare instances when it is visualized and a pre-existing catheter is in place. Do not place a new central line now just to aspirate. So keep the patient supine in left lateral position. So do not do anything, just keep the patient supine. Do not do left lateral also. Hyperbaric oxygen is a definitive treatment for arterial gas embolism, and it is recommended when there is neurologic or cardiovascular impairment. Start treatment as soon as possible, but there is evidence of improved outcomes after 60 hours or longer. Next is decompression sickness. Decompression sickness is due to the formation of nitrogen bubbles in the body tissue and circulation during decompression. So when the pressure is reduced, all the dissolved nitrogen gets converted into gas, forming nitrogen bubbles in the tissue and in the blood vessels. These bubbles cause direct mechanical disruption of tissue, means basically ripping apart the tissue, occluding the blood flow, platelet deposition, and activation of the coagulation cascade. The similar thing happens when there is a decompression in astronauts while going outside the atmosphere. And similar thing happen in ghost flight incident, causing endothelial dysfunction, complement activation, leukocyte endothelial interaction, free radical damage. Hyperbaric oxygen treatment is a definitive treatment for decompression sickness and recommended in all cases of diving decompression sickness. Repeat that. Hyperbaric oxygen is the definitive treatment for decompression sickness and recommended in all cases of diving decompression sickness. If the hyperbaric oxygen therapy is not available, patient with mild symptom who are stable for longer than 24 hours may be treated with supplemental oxygen alone. If the patient must be transported by air to a hyperbaric facility, use pressurized aircraft to maintain at least a sea level pressure during transport, or transfer him at a low altitude. What is sudden sensory neural hearing loss? It is hearing loss of at least 30 decibel occurring over 3 days, involving at least 3 contiguous auditory frequencies, which are 256 Hz, 512 Hz and 1024 Hz. So sudden SNHL is hearing loss of 30 decibel over 3 days with at least 3 contiguous auditory frequencies. Hyperbaric oxygen is indicated for profound sudden hearing loss more than 40 decibels within the 14 days of symptom onset. We can use HBO in exceptional blood loss anemia. As we know, anemia causes anemic anoxia. So if we supersaturate the hemoglobin with oxygen, it might reduce the anoxia. Then there is crush injuries, creating a cycle of edema and ischemia. Then edema causes more ischemia, ischemia causes more edema, thus causing compartment syndrome, and finally the limb dies. It is also used in osteomyelitis, fracture, non-unions and amputations. It is a method of increasing the oxygen supply to the end cell. So basically it does not get infected with anaerobes, debris doesn't grow there, and necrosis doesn't occur. It is a standard therapy for compartment syndrome. HBO can also improve the oxygenation to the hypoperfused tissue in the compartment syndrome. What are the complications of hyperbaric oxygen therapy? They are barotrauma and oxygen toxicity. Middle ear barotrauma is the most common side effect of hyperbaric oxygen treatment. As the ambient pressure within the hyperbaric chamber increases, a patient must be able to equalize the pressure by auto-insufflation or else ear pain. So repeatedly swallow or just do the Valsalva. It can cause tympanic hemorrhage, serous infusion due to difference of pressure, or tympanic membrane rupture can also occur inwards. Standard protocols say that auto-insufflation technique and medical therapy are used when needed. Pulmonary barotrauma during hyperbaric oxygen treatment is extremely rare, but it should be suspected when the patient is having poor lungs or significant hemodynamic symptoms. Oxygen toxicity can also occur. It can injure the brain, lung and eyes. Acute oxygen toxicity manifests as grand mal seizure, reported to occur approximately 1 to 4 times per 10,000 patient treatments. .4% soda bicarb, which we have in our ED, has 1000 milliequivalent per liter of sodium, while normal saline has 154 milliequivalent per liter. Pulseless electrical activity can be of 2 types: narrow complex and wide complex pulseless electrical activity. If it is a narrow complex PEA, consider mechanical cause like tamponade. pulmonary embolism, hypovolemia or bleeding, tension pneumothorax or acute MI. If it is a wide complex PA, consider dyselectrolytemia or metabolic cause like hyperkalemia, sodium channel blocker overdose, acidosis, agonal rhythm, and acute MI with pump failure. In narrow complex, you will see a hyperdynamic LV on ultrasound. In wide complex, you can see a hypokinetic or akinetic LV. In narrow complex, since it is hypovolemia and mechanical obstruction, you can give IV fluid bolus and treat the underlying condition. In wide complex, treat the underlying cause like hyperkalemia है तो IV कैल्शियम और सोडियम देना है, सोडा बाइकार्ब देना है. सोडियम चैनल ब्लॉकर ओवरडोज में IV सोडा बाइकार्ब देना है. What is the treatment of class 1 antiarrhythmics, which are your sodium channel blockers and TCA toxicity? It is soda bicarb. What are the principles of bioethics? Are beneficence, autonomy, beneficence, non-maleficence, and justice. The two more are confidentiality and honesty and respect for the law. रिस्पेक्ट फॉर लॉ जस्टिस में आएगा तो ऑटोनॉमी, बेनिफिशेंस, नॉन मैलिफिशेंस, जस्टिस, कॉन्फिडेंशियलिटी एंड ऑनेस्टी.